Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, Dr. Murphy.
Good morning.
So, Dr. Murphy, a lot of pregnant women have had this question about what is the transmission rate from from mother to unborn baby, and it seems like this latest study shows that potentially maybe there's not as big a concern as there was previously.
This is a virus that really doesn't stay very long, if at all, in the blood. So the babies have been very protected and basically, essentially no transmission to the child. You know, this is in contrast to Zika virus, as you remember a few years ago, where the babies were very badly affected.
Reports of a new vaccine that's coming forward here from Novavax. Tell us about that one.
Novavax, yeah, this is the so this will be the fifth vaccine that's coming forward. The next two are J&J and AstraZeneca Oxford vaccine. This will be the fifth one. They just started their phase 3 study, a different kind of technology altogether. So what in this one, the vaccine has the spike protein in it with this very special adjuvant, which is very common to put with a vaccine to make it work better. So it's a very different kind of technology than the other vaccines, and only requires refrigeration type temperatures to move around. So that'll be good. But they just started their phase 3 study, so that's going to take a few months.
Dr. Murphy, there's been talk about how you track people who get the vaccine and people who refuse to get the vaccine. In Spain, they're talking about creating a register that might be shared with other European Union countries. What do you think about that idea, and do you expect to see something similar here in the United States?
I was really kind of surprised to hear that.
Yeah.
So the Spanish are going to do, which is Spain is having a very difficult time with this infection. And the vaccines are rolling out in Spain now. They are going to keep a registry of people who refuse to take the vaccine. And they're going to share that with the other 26 EU countries. And that means that maybe those people are going to have problems moving around while the pandemic is still active. You know, these type of infringements on personal rights and movement, everything, are all related to how dangerous the person is. So, you know, if the mortality rate of the variant goes up or it starts spreading even faster, you're going to see this kind of stuff in many places around the world, and possibly here. It depends how bad it gets.
All right, let's get to some viewer questions, starting with this. I expect to receive my first COVID injection long before my wife is eligible. My question is, if I'm inoculated, will that make it less likely to bring the nasty plague home to her?
Absolutely. Matter of fact, your whole little family bubble, as many people that get the vaccine, will decrease the risk in the little group. If it's just the two of you, it's obviously going to be about 50% less. But if it's a family bubble, it will decrease as the family members get vaccinated.
We combined the three next questions because they're all somewhat similar. One viewer says they're allergic to penicillin, another has eczema. They want to know if the vaccine is safe for them, and a third wants to know if the vaccine will work on chemo patients as well.
Yeah, so let's take it's really two questions here. Look, if you have any kind of allergies, you are probably a little bit more likely of having this anaphylactic reaction to the Moderna and the Pfizer vaccine, which they now have. They have a couple culprits that they think might be causing this allergic reaction, and these may not be present in the vaccines that are following. The J&J vaccine, the Oxford vaccine, and the one we just talked about. So, but although that's a severe reaction, nobody has died from that reaction. But I think anybody that has any kind of severe allergy, you can define severe however you want, which includes an eczema person, should have the vaccine in a hospital setting. So, you know, when a hospital gives it out, I wouldn't have it at a pharmacy or, you know, some other facility where they're going to be giving these vaccines out. And I think that's just the safest way to look at it.
All right, time for one more quick question. How long after you've had COVID can you be safely around people? Do you need to get tested again until you test negative? And how long after can you get tested again?
This is definitely one of our most common questions because there's so many people with COVID. So what happens is as soon as the person with COVID, when they lose the fever and most of the symptoms are gone or predominantly gone, like a 90% improvement. Maybe they still have a little cough or something. You add 10 days to that, and then you're clear. You do not need another test. You just wait that time period because they've looked at those patients, and after that time period, they are non-infectious.
All right.
Dr. Murphy, thanks so much. Good to see you.
Great. Good to see you. See you tomorrow.
Sounds good. If you have a question for Dr. Murphy, head to our Morning News Facebook page and post it there. We'll talk to him again tomorrow morning. Let's get a check of the weather now with Mike. Good morning, Mike.
Good morning, Lauren. Starting out this morning with